really give a kind of real case scenario of what happened, how she came into the office, kind of what went down last Saturday when this 8-year-old came in and couldn't barely move her neck.
Yep. So her mom calls, and so I'm up at the office adjusting other people, and her mom calls and wanted to get in on that day. And I was like, well, absolutely. And then she was like, well, okay. And I was like, well, would you like to make an appointment? She's like, absolutely. Yeah. So they came in, and I was thinking maybe a sports injury. It was a Saturday, so I thought, maybe they were playing sports. But so the girl comes in, and her neck is all cocked all the way to the side, and it's stuck.
Like ear to shoulder,
left ear to left shoulder, and she can't move it. Now she's 8 years old, so you really shouldn't have anything like that at 8. I mean, I've seen it multiple times, but like, it's not a normal thing for someone to have that.
So there's no history of injury with this patient?
Nope, no injury history. She was just watching her brother play ball, so nothing was going on. Nothing traumatic happened to her that would have led to that. So when she comes in, so we obviously have to ask the right questions. Any history of traumas, and no, any health conditions that we need to know about, no. So you have to go through a line, like when someone shows up like that, because it is very abnormal for an 8-year-old to be like that. So we got all the red flags crossed off. None of it, none of those different things. And then felt like it was, time to start working on it. And so I did a little exam on it. Now, she did not like me touching that neck very much.
It's tough.
And early in my career, I remember, seeing one of these, and I was like, oh boy, what the heck do you do with that? And so now, since I've seen multiple ones, I'm like, okay. And so I just looked at it and I told her, I said, hey, this isn't going to be the most fun you have today. I said, but we're going to have to do what we got to do. Now, we're not going to win it all in one day, but we're going to have to do what we got to do today to at least get this alleviated. Now, in my opinion, when we first started, I didn't really know how far we would get with her neck. I thought maybe we would get it to straighten out a little bit and then reassess later on. Because a lot of times, so when people come in, we feel like we need to win it all in one day, but it's just really not. It's just really not. What am I trying to say? It's really not feasible with most conditions. So when I started working, or when I examined her, I noticed that her lower neck, so like C6, C7, was way off towards the left. It was just not where really it should be. And when I say that, it's not like the bone like jumped all the way to her shoulder. It's not like that. But any millimeter of kind of translation to the side can be really painful and can really mess up the range of motion within someone's neck. So I'm palpating that. I'm like, wow, that's that thing's way over there, which what'll happen is if it translates way over to the left, then your neck's not going to do what it's supposed to do. So what we have to do is we have to examine it and go, okay, what's the actual issue? So lots of muscle spasm, and then that vertebrae way off there towards the left. So her neck is stuck there. So the first thing we have to do is we have to start getting some of that spasm out of there. And then the game beyond the muscle and bone is talking the patient through it, because she's in a lot of pain. She's crying, but you got to be confident, know what you're doing. And so I told her, with the condition that she has right now, she's not going to get any worse with what I'm doing. It's going to be painful a little bit, but it's going to go away after I stop treating it. So I probably spent a good 15 minutes doing trigger point work on that specific muscle and just slightly moving her head, and just kept on going until we got that thing back to where it was supposed to be. And then, so at the end of the day, she walked out and head was straight up. Now, the next day she had some pain, and that was a Sunday. Then she came back Monday. We adjusted it, and then she's been fairly good. I'm going to be seeing her next week, but she's been fairly good since then.
Yeah, and isn't it the best when it's a young spine that you can kind of younger humans heal quicker? I mean,
yeah.
And so, even just the repetitiveness of looking down at an iPad or carrying around a heavy book bag, even at 8 years old, you can injure yourself to the point of, affecting the little gal's weekend.
Well, exactly. And a lot of times we don't think that kids really have issues, or they shouldn't. They're resilient. They're kids, which they definitely are. They're very resilient. But the problem is that they can be injured just as much as anybody else can. But I know the kind of the perception, or the idea about kids will, jump up and put some dirt on it and you'll be just fine. Well, I really think that for any of the parents out there that are listening to this podcast, yes, that's very true. But sometimes there is things about kids that do need to be addressed because of their posture, because of the things that they're doing, and also the amount of sports these kids are playing nowadays is a lot on their bodies.
Yeah, and I think you need a good combo, get up, rub some dirt on it, and then we're going to go get it adjusted or treated,
Mm-hmm.
and so it's kind of that. And I would say that's the hardest thing about being a physician is everybody's different when it comes to their subjective pain tolerance.
Mm-hmm.
So it's kind of like, you got a 45-year-old carpenter who's got severe arthritis, chronic pain, has lived with it for 25 years. His 5 out of 10 isn't the same as Mary Jane's, 29-year-old spine, who's, everybody's different in their pain perception. And children especially, it's scary. I remember being 18 and your head's turning and the ceiling spinning around like it feels like your neck's going to pop off.
Yeah.
And there's a trust factor in what we do as well.
Yeah, absolutely. And I think, like, so that we don't know what we don't know. And so that's why, and me and Dr. Agan always preach for kids to at least get checked out. We're not saying that all the kids need to come in once a month, but what we're saying is getting your kid checked out and getting their spine looked at and examined early can help them bypass a lot in the future. And it's one of those things that you won't really know.
Mm-hmm.
But we know, because we're getting a lot of 20-year-olds that had, issues, and it wasn't too far before that. They were teenagers doing dumb stuff, and before that, even younger. So we're seeing people in their 20s that, oh man, I did have back pain for a long time. Mm-hmm. If it would have been addressed earlier, then we could have helped them out even a little bit more. So very important for kids to at least get checked out and be on the right path, just like a dentist or anything like that.
No doubt. The chiropractic phrase is who can be adjusted, and we always say from the womb to the tomb.
Yeah.
It's some way. Now the difference in treatment definitely changes throughout that.
Yeah, absolutely.
I've adjusted 5-day-old babies before, and the amount of pressure force is nothing compared to your 35-year-old male who goes to the gym. It's all, like we've talked about before, it's art, technique. But I truthfully didn't realize the importance of getting adjusted at a very young age until we got into practice. I know we learned it in school, and we heard stories about it, but I've seen, especially my favorite is actually when a mom comes in before being pregnant, gets pregnant, and gets adjusted throughout her pregnancy as a maintenance schedule. And then she has the baby, brings the baby in a couple weeks later afterwards, and you connect. And it's really strange. I don't even know how to explain it, but I've seen it enough where, we are all energetic beings. So that, when the baby's, before it's born, it's a part of the mother. Mm-hmm. And they can hear the voice and the vibrations and everything. It's like they've experienced it before. And again, until you've really seen it, and even to our viewers, I've seen it enough to know that is real. So the baby comes out, and it's like we've already met in a weird way. Mm-hmm. And that is my favorite adjustment, man. You look at those eyes and they're so innocent, and you can see the life in those eyes, and just connecting with them. And then when they follow through, it could be a monthly maintenance schedule for your child, that really, when you start them that young, you're preventing them. How many times does a 2-year-old fall down on their butt? Mm-hmm. Thousands of times throughout a year. And that's normal. That's how we develop. And and that's what we preach again, that this is such an amazing time that we know this now.
Yeah.
Healthcare's ever revolving and it's going to be constantly changing. So we know now with the data, and we've seen it with our experience, that starting them young, they don't need as much because you're slowly molding their spine, and then they get to be playing sports, and being active is vital. But with the slips and falls and repetitive stress, and a lot of times too, it's so important to vary the sports at a young age. Don't focus so much on one.
Right. Yeah. I mean, so nowadays sports, so say like, we played baseball. Nowadays we're talking to kids and they come in and we actually have a high schooler that's working with us, and he tells us a little bit about his kind of experience with ball. They're playing all the time, and you really don't really have much time to do another sport. I really like the multiple sport approach because you're using different muscles, you're doing different things, you're acquiring different abilities, which is really good. And also, you're just not putting a ton of stress on the same thing. If you're a pitcher and you're pitching all year round, it's tough.
Mm-hmm.
Even the major leaguers don't do that. They're going to take time off where, yes, they're going to throw, but they're not throwing ball games all the time. But really, because physiologically, it's hard for your body to handle it. And for any of the baseball fans out there, you're noticing how many Tommy Johns are we having nowadays? I mean, they're all over the place. But to kind of wrap back, talking about being adjusted earlier, or early and often. So I can attest to that firsthand because my dad and grandpa are chiropractors. So I lived that life where I was adjusted earlier. I did go to my dad's office when I was hurt, got hooked up to got hooked up to stem, had the ultrasound. My grandpa did acupuncture, so I had acupuncture. I think the first time I got acupuncture, I was maybe 13 on my hamstring. I pulled it. That means you're wound tight if you pull a hamstring at 13. Yeah, I pulled a hamstring at 13. But yeah, so I've done chiropractic my whole life, and I'll tell you now, this is one of those things that people aren't really fond of. But well, I'm not saying they're not fond of, but it's real. But I will tell you, so growing up, I didn't get sick as much either. Mm-hmm. Now, knock on wood, I'm not really superstitious anymore, but I didn't get sick much. I didn't get hurt as much. And I really believe it's because of being adjusted often, making sure that everything was moving the way that it should, and also being early to detect things and not letting them linger.
No doubt. And you think too, it's like those milestones in a child's life. So, from 0 to 2, and from crawling to walking, standing, falling, and then they just become madhouses after about 2 years old. So, and they're everywhere. So you're right. And they're resilient. There are a lot of them, we're all made of cartilage for majority of the part. And that's why we can bounce. But like you said, it's those stress points that happen. There's actually and you know what I'm talking about, but a spinal fracture that can happen in infancy, or around 2 to 3, and you see this a lot when they go to stand and they fall straight on their butt. Mm-hmm. It can cause that pars fracture. Yep. And you don't know it until you take an x-ray when they're 40 and they've dealt with back pain for 15 years. It is a common way and you don't know. And a lot of, I remember even in school, we can fracture our spine and not be paralyzed.
Yep.
There's specific areas. Yeah. Just like any bone that can break, but if there's no vital structures around it, i.e. the spinal cord or cauda equina, which is horse's tail for all those nerves at the base of your tailbone. Mm-hmm. But a lot of it, yeah, and even I think those patients that, the moms that bring in their kids, parents that bring in their kids, when they're growing, they hit those milestones quicker. Mm-hmm. They walk around, they develop a little faster. And like you said, I mean, weren't you throwing like mid 90s and like 14?
That's that fish getting a little bigger. I keep getting older. That fish keeps getting bigger. Yeah. So pretty soon in the next 5 years, I threw at 105 when I was 15.
Oh yeah. I used to throw a football quarter mile.
Throw it over those mountains over there.
So it is vitally important for parents to understand how that can prevent issues down the road. Mm-hmm. And so if we can again change the mindset now. We are in a preventative maintenance healthcare vision at this point in time. That's the only way we can be and take accountability on ourselves. And it's an investment. But
Yeah.
just like going to the dentist, just like going to the eye doctor, orthodontist, chiropractic needs to be grouped in there for wellness, because just like you don't want your teeth to be nasty and crooked when you're 45, we can't see our spine, so we don't know it, but that's exactly what's happening if we don't, follow through with any type of maintenance.
Yeah, yeah, absolutely. I mean, we're and most parents that I talk to here, I mean, and most parents would agree, they have invest their whole lives into their kids. So you're doing all these different things for your kids to have the best opportunities and the best everything. Well, you got to make sure that little Johnny's body is working the best that it can as well, because that's everything. I mean, it really, like when you, and I think even when I was younger, I didn't quite understand it. I'm like, okay, yeah, you need to be adjusted, blah, blah, blah. But like you said, we can't really see the spines. So we're like, if you can't see it, then, well, it's
Yeah.
okay, right?
Mm-hmm.
But in reality, we're seeing these changes in 20 and 30-year-olds that could have been prevented before. So it's important to get checked out, make sure everything's moving the best. That way that your little kid does have the best opportunity. And we always go back to the kind of the car and maintain your car. I mean, to be honest, most people put more time into their cars, maintaining their cars, than they do their actual body. Which is, when you like think about it like that, it's freaking nuts.
Yeah.
But that's the truth. I mean, that's the truth, because we did also grow up in an era of, just buck up and let's go.
Mm-hmm.
But really, you're really just trying to take care of yourself.